I just wanted to take a time to say thank you, Fran and Sherry and team, for inviting me to be a part of your panel this morning. Also, it's always good to be amongst friends, Lexia, Carol, who I've been spending a lot of time with as of recent other projects, my good friend Onaje and Dr. Williams, and it's just good to be here with all you great folks doing some very important and necessary work in our community. Just want to talk briefly a little bit about building resiliency through trauma. As you said, Fran, in my bio, I am a Chester native who has experienced trauma myself. I've been a victim of trauma on quite a few occasions, violence, which you'll see as I get into. So if you can go to the next slide, please. Who is Cory Long? So first of all, I'm a father, I'm a husband, I'm a grandfather. These are my babies there, and that's my grandmother who raised me. You see my wife, Ronette, and our 4 kids and my grandson. Next slide, please. And I'm also, as was read in the bio, the founder and executive director of the Making a Change group. We started out actually as a grassroots mentoring program back in 2004. And around 2014, evolved into the Making a Change group, a 501c3. Next slide, please. A lot of factors for me growing up could have prohibited me from being any of that: father, grandfather, husband, executive director. You'll see me in the first slide with my mother at the age of 1. Then you'll see me just 12 years after that at the age of 13, the gun. And that the next 2 pictures aren't actually me, but they're just a reflection of a person who I was at the time. And at the age of 13 is when I had my first encounter, I'll say serious encounter with violence. And I was going to a school, Catholic school here in the city of Chester. And we were getting harassed by some young men from the neighborhood. And one of my classmates brought the school his grandfather's gun. And he said, next time they come and harass us, I have a gun. And so as a kid, I'm fascinated. I want to see it. I want to know what it looks like. And so I asked him, could I hold it? And so we walked home from school that day, and I'm holding his grandfather's gun. And these kids come up to harass us. We get into a big fight, and the gun falls out of my waist. One of them picks it up, and thank God nobody was hurt, no shots were fired, and the young men were arrested for coming to our school to bother us. Well, they turned in the gun and said, well, the kid named Cory had the gun. And so that was my first encounter with the law. And I wound up getting just some probation or house arrest or something around that time. Fast forward to another 12 years, to the age of 25, I was DJing at a nightclub. So prior to me working in the community and doing community work, I was a radio DJ and DJing in one of the clubs on Delaware Avenue in Philadelphia, and got into a club fight. Got into a fight after the club. I was stabbed 13 times and literally left for dead on the doorsteps of the club. I was literally almost bled out. Statistically, the reason why I said I should not be here, statistically, as I spent some time as the anti-violence coordinator in the city of Chester, these are the numbers during the time that I was anti-violence coordinator, between the ages of 10 to 24, of crimes during the age of 10 to 24. Let's see, 249 aggravated assaults, 334 narcotics violation. This is particularly troubling for a small city like Chester with less than 34,000 residents. Just look at the ages, and this was 2010, so this was 11 years ago. Just look at the ages between the age of 10 and 24. And as I said to you a few minutes ago, my first encounter with a gun or with violence was at the age of 13. And my last encounter with violence was at the age of 25. I literally fall right directly into these statistics. It was during my time in the hospital from my stabbing that I met some of the most beautiful, wonderful, kind-hearted nurses that helped me heal. At the time, a 25-year-old young man who was literally laying on what could have been and what I thought may have been my deathbed. Those nurses cared for me and were just a saving grace for me on that operating table, in my room. And once I healed and got out of the hospital, I came in contact with a very caring social worker that just walked me through a process that even after I was hurt and dealing with my wounds and dealing with my healing process, I still had a tremendous burden, financial burden from the hospital bill and things. And so this social worker that worked with me, she was able to connect me with several programs to get a lot of my hospital debt eliminated and just be a caring support system to me. Not too long after that, I dedicated myself to the Lord, to my local church, and began a spiritual journey. And that also helped with my process of becoming the man that I am today. We can go to the next slide. But it was really I'll say to the nurses and those social workers that I met at that sort of tipping point in my life that really had a lasting effect and had a healing imprint on me, even to this day. And because of their care, because they were willing to go the extra mile for me, even in a small way, I've been able to do some pretty great work here in the city of Chester. These are some of the lives of the young people that I've been able to work with and impact through our Making a Change Group program. So after 17 years of working with young youth and families, again, I give a lot of credit to those nurses, those caring social workers, and my pastor, and folks that have helped me through my own personal trauma when I walked or went through that journey as a victim myself, and helped me turn from a person that was hurting to a person that's now become a healer. Thank you.
Good morning, everybody. So I'm Sandy Durgin. I'm the Trauma Program Director, as I heard myself introduced, for Crozer-Chester Medical Center. And I'm also the Interim Director for the Burn Unit. Crozer-Chester Medical Center really embarked on this journey over the last almost 2 years to figure out how we can have an impact on violence in this community and beyond. There's some things being done at the state level in terms of looking at firearm laws, but we really can't do too much on a macro level, and it's better to start on the micro level. So we joined forces with the Chester Community Coalition, the Chester Peace Initiative, and have signed an affiliate agreement. Really, our goal is to intervene with patients who are victims of violence here in the hospital during their admission, and then to give them resources once they're discharged. We've noticed that there seems to be a pattern of violence amongst families, not because the families are violent, but because they're probably in the wrong place, wrong time. We see that not infrequently amongst our patients. It's not infrequent that we see brother, sister, mother, father who from the same family who are continued to be victims of violence, which is really disturbing to us. We see about 180 victims of gun violence every year here at Crozer. And we're hoping that with this new affiliate agreement, that maybe we'll make a positive impact with the community and decrease the violence, decrease the readmissions with patients being re-injured, and hopefully support our patients and their family members as well to go on to heal from this both physical and mental trauma. We're just This program really is in its infancy. We haven't really gotten too much off the ground, but we're working hard on it, and hopefully we'll have people in seeing our patients very soon. We have been referring patients regularly to the Chester Community Coalition, and we're waiting to kind of see the fruits of all of our labors. But I suspect it's going to be a long-term event, and we probably won't see anything too immediately, just the nature of trauma kind of heading down through families.
So I just want to kind of reiterate and echo a number of the sentiments that have been expressed today around kind of the collaborative effort that we are demonstrating as respective organizations that are coming together to address the concerns that we see in the community, and are developed programming to make sure that the folks in Chester and those organizations feel like it is an initiative that we can address. So I think that when we think about the work that we do, it's important for us to keep in mind that we are all working towards a similar goal. And I think sometimes when we feel like we're doing the work, maybe aren't seen or being seen in different ways, that can impact us as organizations, as individuals, because of how passionately we view and see the effort and initiative that we're putting forth in the city. But the fact that we're all working towards a common goal should be something that we keep at the forefront, that allows us to really feel and stay connected across the time that we spend. So as was noted, I am the clinical director at Chester Community Coalition. And in the time that we have been in the city, we have really grown to really accommodate the needs that we see. And I think that that has been one of the greatest, most rewarding parts that I have seen in the time that I've been in the organization, is that we're really responsive to kind of what the community needs. So by coming in and sometimes being outside forces and organizations, we have a thought about what might be most helpful. But what has really been impactful for our organization being able to grow and continue to receive support is that we have a listening ear to the community around whether or not what we're offering, what we're doing, is still relevant. So even when we started 3 years ago, we were under the impression, after having our focus groups and meeting with community leaders, that the work that we were doing was exactly that. The groups were most important and what was most needed. And in more recent talks and meetings with folks in the community, we recognize that there are other things that may keep them from being able to really address the supports that we're offering, and have shifted to be able to include that in our offering. And that seems to have made the difference in terms of folks feeling confident and comfortable with then being able to access additional service offerings. So on the next slide, I kind of outline not just some of the things that we've offered before, but some of the ways in which we have grown. And one of the things that we've seen as far as kind of benefits to being able to support the community. So when we notice that community organizations like hospitals, other communities getting involved and providing services are communicating and working with one another, it usually leads to greater satisfaction in terms of adherence to treatment, feeling heard and feeling comfortable, and the reduction of stigma when my doctor is communicating with the therapist, whether that's physical therapists or therapists in a mental health way. But those community-based supports and supports received outside of that initial contact with the hospital are profound in terms of being able to really support the whole person following injury. It also allows for us to be a part of this person's family and support unit. And so I think when we think about an injury happening, I know oftentimes we're working with just that individual, but in a city like Chester, we're really working with the entire family. An entire family, an extended family, could be impacted by injuries sustained and things that happen within the community. And so it allows us to be able to develop and maintain those relationships while folks are receiving support. As well as recognizing that services tend to need to be provided where people are. And so we have found, and again, have shifted the level that we provide service to recognize that we go in with the intent of maybe offering and providing therapy when folks say, there was a lot that happened in my life that was kind of disrupted when this happened to me. And those things need to be replaced before I can consider other factors and other things. And so listening and being in tune with that is super important to us as an organization, and being able to meet and provide services where people are. And then again, that multidisciplinary and collaborative approach allows us to support that whole person. And so you'll see on the last slide, again, the services that we provide at Chester Community Coalition. We have expanded our services to include individual counseling in addition to the group counseling. And we provide group counseling on 3 levels: our healing and strength, which are folks that have been impacted as far as a loss of someone to gun violence in the city, and are dealing with that grief and loss. And it's usually for folks that are about 6 months out from the event, or have experienced and are actively involved in some of their own individual treatment around it, and are coming together as part of kind of supportive healing in a group setting. Then we have our survivor and caregiver groups, so folks who have themselves been a victim of gun violence in the city, or those who are caring for someone who is a victim of gun violence in the city. And then we have art therapy for our younger children as well. We've seen the benefit of case management. Like I mentioned, there are other barriers that can really affect one's willingness and ability to really engage in some of the healing work initially. And so by providing case management where we support folks around reconnecting to employment, or finding housing, or additional food sources for growing family or family that's impacted by a loss of a job, has been extremely important in that healing process, and feeling like they can kind of return to a sense of normalcy before they may be ready to engage in healing. We also have an outreach arm that allows us to connect to other organizations like Making a Change Group, like the Crozer-Chester Medical Center, and that we found super important for the work that we do, as well as our Hospital Link program, which Sandy talked a little bit about, and trainings that we offer at the school district level for other organizations around trauma as well, and that level of professional development are arms that are growing, that we see our place in being able to support the city. And so I think that if there is one takeaway from the talks and work that we've done today, one of the things that really stuck out to me was something that Jacqueline talked about in terms of creating a culture where folks that are doing this work can be filled back up. And I know she was talking specifically about kind of in the hospital and making sure that there's a culture there. But my hope would be that as we continue this collaborative work in the city, that we create a culture within those working in the city towards this initiative, where we create something very similar, where we are pouring out and doing this work, but that we also create and establish this connection where we can also be filled back up and reach a level of compassion satisfaction, which is that acknowledgement that the work that you do is important, and being able to hear that and be in spaces where that is affirmed and celebrated. So that's what I would have to contribute at this time.
Good afternoon, everyone. My piece for this equation is to kind of talk about the specific work that we have been doing with the Chester Peace Initiative and how it can work in collaboration with some very important stakeholders to our community as we address this issue of gun violence. And it is a privilege and a pleasure to be with you all and be a part of this august panel. And as Cory had mentioned earlier, it is always interesting to be among friends, and always an opportunity and a blessing to be among friends. And again, I'm gonna say to Cory, every time we end up in the same panel, brother, I learned so much more. I learned something new about you, man. And I really thank you for your transparency and honesty and sharing your story, your journey. The Chester Peace Initiative is a federally funded grant implementing the Cure Violence model specifically for the city of Chester. We have partnered with and we're proud of this very exclusive partnership between Crozer Health, Chester Community Coalition, and our organization. We are really the blessing of the Ministerial Fellowship of Chester and vicinity, and the brainchild of the ministers. In the Black community, the church has always been on the front end of addressing social issues and concerns. And so we are the blessing of the Ministerial Fellowship as we present our work in addressing gun violence. We are definitely thankful for the opportunity to collaborate with key government entities as well. This segment is talking about networking, and the strength of this particular implementation of the Cure Violence model is that we were extremely intentional to make sure that key stakeholders throughout the community, city government, first responders, the police department, and of course our funder, the Pennsylvania Commission on Crime and Delinquency, were the pivotal agents in helping us to come to fruition. But beyond them, there are so many other organizations that sit in the background that are intricately involved with us. And it took over a year and a half to build these collaborations so that this would not be a ministers or a church initiative. It wouldn't be a group trying to get limelight, but this is truly the best opportunity for a community of stakeholders to come together and stand together and say, listen, we are going to do something about the issue that is hindering our development as a city and as a collective. And so we're very thankful for all of the key stakeholders who continually support this work. The model for Cure Violence is an internationally accepted model. It works no matter where it has been deployed on the globe. It does not change. It is a very scripted, evidence-based approach that is the gold standard. We saw when you go to the copy machine, you say, I'm going to make a Xerox copy. That Xerox means that they were the standard. They were the ones who set the bar, who established it. Cure Violence is the one that everyone else says they're doing violence interruption. They're using everything in place that's been given to this work from the Cure Violence group. And so when you talk about what does it mean to address gun violence, the lingo, the differences that you're using, the definitions of terms, all of that comes from the Cure Violence model. And that's the blessing that we have here in Chester, to have a recognized, evidence-based, proven approach to dealing with conflict in an urban setting. And it's a simple model. We interrupt transmission. We reduce high risk by engaging in very tactical and strategic relationships. And at the end of the day, if the community doesn't change its perspective on violence, then the work is null and void. So we must, and we intentionally do what we can to help change also the community's perspective on violence. Cory shared with you some very important information that I think that segues to my presentation, and having not interfaced with him, it is truly, I think, the blessing of God that we were able to see how we collaborate. He shared with you his testimony. Cure Violence, our participants in our organization, who we go for, they must have at least 4 of these credentials to be considered what we consider the right participant for this program. They must be between the ages of 16 to 25, formerly incarcerated, have previously either shot, had a friend shot, a peer family member shot, actively involved in violent street organization, a history of violence, whether it's in their home or outside the home, an alleged weapons carrier, and or engaged in high-risk street activity. For our participants, we've been in, as it's been shared, we've been in operation since 2020. We have over 40 individuals in the city of Chester engaged as our community of participants. And here's the statistics on it. Chester doesn't necessarily have a gang problem, but the use of cliques or crews or mobs, if you will, 97% of our individuals are in some sort of social group that hangs together. 69% of them have a key role in the group that they associate with. 63% of them have prior criminal involvement. 93% of our participants are involved at the moment in high risk street activity. And strikingly enough and surprisingly enough, only 8% of our participants have been a victim of a shooting. As I said, our participants are between 16 to 30 of them. 80% of them are between the ages of 16 to 30. 64% are formerly incarcerated. And believe it or not, and it's really disheartening for someone who's really a strong advocate for education, only 23% of our participants have either a high school diploma or GED. 76% of them are unemployed. and 56% of our clients are either on parole or probation. And so we're dealing with a group that not many people want to deal with because of the stigma for what they represent. We consider ourselves, if you will, we consider ourselves the NBA of those, the NBA champions for those who want to come out of this cycle of violence and do something better, because our participants have something in common with our participants have something in common with the individuals that work with the organization. I want to give you a behind the scenes look at what actually happens. This is from a documentary that was done on Cure Violence when it began over 20 years ago. And I've taken some pieces of it I want to share with you so you get an idea what our individuals do when it comes to engaging with our particular participants.
Violence is learned behavior. So let me clear that right. I don't mention gang names.
Can you all hear that by chance?
Right. At this transitional home for teenage parolees, the residents were in conflict with one another, and they were putting in gang members from throughout the area. It was about to blow up in a major way. The problem that we have right now is about some money that led to a fight, right? How much money was it? Like, it was about $5, everybody.
Dude said instead of giving him $5, give him 15. No, it don't work like that. You ain't gonna get no more than what you want.
He said, I'm not paying you. Right. 5 minutes later on, they came up here.
It took me as a woman to stand in the middle of the street with 15 guys that I knew nothing of, and to have come out of my pocket and pay $15 a piece. No respect for where you live at.
Think this could turn into gunplay?
Yeah, I think so, because it's gonna escalate, it's gonna keep going and going.
But we gotta live here, man. I don't wanna bring these streets over here, man. I ain't trying to go back to that life. I'm one man. I can't fight all around. What you think I'm gonna do? Heck yeah, I'm gonna get me a double.
Like this brother just said, anytime 15 guys mob up on you, the first thing comes across your mind, I need to be strapped to deal with that. If you gotta live here and coexist with each other, someone has to be big enough to take the higher role.
It's gonna go through one after the other.
Look, you know, the most important thing, pay attention to what they're saying, because at this site where you live at, if you cause any kind of trouble, 50 will be called.
I'm hearing what they telling me in there, right? And to me, it's like starting off with a $5 bag of weed.
It's beyond that, beyond.
But wait a minute.
I get fed up.
No. You gotta play it like a big man. I gotta play it like a big girl. When I get angry, I can bring some noise if I want to. I go lay it down. I have to. Don't make me feel like a punk. It make me feel like, you know what? It's fighting my own ego. I swear to God, I wish I had somebody to holler at me like I'm right here hollering at you. I would have not had the feeling in my record. You understand what I'm saying? What we gonna do? We're gonna fight about another $5 bag of weed? They feed off her energy too. So what you gonna do, son? Tell me, and I'm gonna hold you to it.
Make myself better.
You too.
You know what I mean? If they wanna let it go, we can let it go. People love.
So this is a mediation of this is an actual mediation that happens, and this is what our workers do when it comes to involving. And our work is from beginning to end based upon relationships. Without proper relationships, we cannot get anything done of credible or of necessary production. Our workers have to be credible. They're very streetwise. They're connected because they're from this community. They're able to relate to our high-risk participants because they have something in common with the participants. They're very empathetic in terms of their approach to dealing with individuals, and we consider them to be suitable for the job and the task of what they are doing. And what's interesting is when it comes to relationship building or networking, why it is so key to have a network and relationship with our high risk individuals, because then we get notified of potential shootings. We know when conflicts are brewing. We're able to have some impact and hopefully try to de-escalate things that are escalating and need intervention. When it comes to relationships and our high risk individuals, we know when retaliations may occur. We know when violence has occurred. There's a whole network of communication that happens even when the media has not heard of something, we know what's going down. And so it's our responsibility to try to get in there, not as police department or police officer or undercover cops, but as individuals who care about the welfare and well-being of the individuals who are in our program. And so we strive to be introduced to individuals or groups in particular neighborhoods. I want to show you how the hospital now can come into play. What you've just seen is what Cure Violence specializes in outside of the hospital. However, there's another piece of this component, another piece of the puzzle that is extremely important when we go to dealing with hospitals and their role in dealing with violence, and how we're so excited about Crozer-Chester. This is a VI situation within a hospital context.
24, we've had some close calls. Several violence interrupters have been shot at. Brother Joel, still a lot of pain. This is the first time one of our violence interrupters ever got shot. I can't be able to tell you we appreciate you and everything you did to try to mediate that particular conflict. I'm just glad you survived. You know, you stumbled across this coming out your father's house.
There was a couple guys down the block arguing over some money. As I was approaching them, I had like something like telling me like it wasn't even the right moment to even interrupt them. I'm just trying to, do my job. One of them said, "Who are you? You ain't from around here." I said, "Go talk to his other friend." And then that's when he shot me up.
Yeah, when you turned your back.
Yeah, when I turned my back.
So you got shot in the ankle and in the back, right?
Yeah. They opened my whole stomach open.
Yeah, it's tough, my brother. Because the day you got shot, there were like 16 shooters in 6 hours. So I need to know all the guys came up here Friday. All the brothers were here. Yeah, we were here, and it's kind of tough, that's all. When I thought about you, getting shot and your father was there, because I have sons, I got a son like 24, got another son that's like 28 years old, believe it or not. So when I thought about it, I'm a human. Yeah, we get good, we'll be all right, though. We just got to just keep on pushing. Okay, appreciate you, no brother. All right. Okay, I'm going to get up on out of here. And I'll be back Wednesday. All right. Yep. Oh, man. Yeah.
This is what we call the golden moment or the golden hour, and where hospitals can really play a very integral and critical piece to the equation for cure violence. Now, to T.O.'s defense, T.O. is the individual who actually is used to be over the program Cure Violence Global, and he took part in this, what we call a hospital intervention. And normally this does not happen with a violence interrupter. This is what would happen with a client. But I wanted to use it as an object lesson for the golden moment and how precious it is to our work, and how the hospital is so critical. During this time, there are two things I want you to take away from this video. The victim had the opportunity to do some reflection on the moment. He knew within his own personal spirit, that he should not have gone in and taken the risk to interrupt. But he decided to do his job rather than listen to what we would call his intuition or something in him telling him not to do that. We're trained to be more tuned in, to stay with what you know to do and only interrupt as you know you are qualified to interrupt. Here, one critical decision almost cost this individual his life. And so T.O. helped him to have an opportunity to reflect on the moment. We normally with a victim that is not necessarily an interrupter, we would then go through and have the individual reflect on the moment, not looking for judgment, but just trying to get a recounting of what happens. Then we would evaluate, have the individual talk about the safety of him, his family, his crew, whoever's involved with him. Then we would have take the opportunity to do an evaluation of the next steps. And of course, and the most critical piece to this component is to provide trauma-informed care. The key to trauma-informed care, as T.O. showed you, our interrupters are so close to this that they don't see a patient. They see their son, they see their daughter, they see someone that they care about. And so there's a certain level of empathy that goes into this work that is able to help a person navigate these challenging times. And this is where hospital engagement is very critical to helping alleviate violence within a community. Being trauma-informed means understanding that experiences like violence affect the way someone thinks, feels, and behaves, including their hyperarousal or depression, and being able to tailor their approach to, or at least not punish or re-traumatize someone for exhibiting trauma symptoms. I've got 3 last things I want to share with you, and we'll be out of here. How does cure violence workers and a hospital violence interrupter come to play? Both of them have very similar roles when it comes to the population served. They both deal with the highest risk people who are involved in violence, intended victims, groups involved, likely to retaliate individuals, family members of victims. Where the hospital violence interrupter goes a step beyond the cure violence model, and we are very comfortable with this, is they deal with people who are unintended victims, unlikely to retaliate as well, and those who are dealing with physical assault. And so it's important that we not just deal with victims of gun violence, but there's a whole nother cadre of individuals who are prone to this work and who would benefit from having an HVIP. The staff, mostly in good situations that we have found, they're formerly incarcerated, who are cure violence or hospital violence interrupters. They reflect the community they serve, which for Chester is extremely important that an HVIP cure violence worker reflect who they are in, who their clients going to be. They need to reflect financially, they need to reflect racially, ethnically. There needs to be, the individuals who we are connected to need to be able to see someone who looks like them in order for this work to have its greatest benefit. Lived experience, they must be able to build rapport and have credibility with the population. And in many instances, both groups are trained in health and or public health methods. The HVIP is a little bit more sophisticated of an individual though, because they will have to be able to navigate the very unique criteria that hospitals have. And I want to add this as a piece. The staff for an HVIP role have the added benefit, as well as the cure violence benefit of being, we have created what we consider to be a brand new professional for public health. There was no such thing as an HVIP or cure violence worker when it came to public health. You had doctors, nurses, anesthesiologists, and everything. We have created literally a brand new professional role within the healthcare industry that must be given the due diligence and respect and regard as a professional. These are not just individuals who are trained and that's it. No, these are trained professionals who bring a certain key element to the team, the healing team. And then thirdly, services provided, both teams provide the same services for the most part, whereas in the hospital situation, we can have more rapid response. There must be HIPAA compliant, the professional must be HIPAA compliant, have trauma-informed care, counseling skills, and be able to be part of the medical care coordination efforts of a hospital. In conclusion, the benefits of collaborating treatment plans are much more comprehensive. We admit in cure violence, we are not the professionals for wraparound services. That's why we build collaborations and networks with other folks. Our main priority, number one, is to deal with the issue of gun violence and to try to help mediate conflicts and get health and healing to our community. So there are wraparound services that we're not qualified to do, and we want to stay in our lane. Hence the need to network and be able to connect with people like Chester Community Coalition and Crozer Hospital. Follow up collaboratively between all of the entities is key, as well as communication. The removal of barriers, which was talked about with the CHOP presentation. When we deal with this work, it is truly a blessing to be able to have a patient be able to be passed off warmly to different agencies and different inputs that will help them get the overall care for their future. And then together, we all reduce the reduction of retaliation and violence exposure. We change community norms by working together, And for the healthcare industry, the beggars walk away for a hospital or someone in the healthcare industry that is looking to be a part of this work, because you will immediately engage in health equity. This, for me, is probably the best benefit of the hospital being involved. In a city where 85% of the population is a minority population, and inequity all around us seems to be the mantra of the day, Crozer partnering with us is helping to deal with, address head on the health disparities and bring health equity back into our community. And lastly, improve community healing and community-based trauma is the blessing. Dr. Martin Luther King once said, an individual who himself was a victim on multiple fronts of violence. He saw violence and experienced personal violence, worked to deal with community violence. He says an individual has not started living until he can rise above the narrow confines of his individualistic concerns to the broader concerns of all humanity. And that's what this effort means to us and to those who are involved in this collaboration. And we thank you for the opportunity. I'd like to jump in and say, I really want to give a huge debt of gratitude and thanks to Alexia, who's the ED of the Chester Community Coalition. She has really tried her earnest to bring together so many stakeholders, and even around this issue of gun violence, bring us all to the table and say, listen, we all have a vested interest in this. How do we make sure we work together and tear down silos and even the opportunity for there to be disruption of our concerted efforts by working together. And so this recently, we have really, Cory and many other organizations have sat at the table, and we're scheduling monthly meetings to come together and say, listen, how do we do this and do it in such a way that has never been done, but it helps the residents of the city of Chester? And then how do we make sure that our particular organization's interest is met? And I just want to say, I appreciate, the grandeur of Alexia being willing to take that on. And the people who are sitting at the table, I can honestly say, I think the people who have come to the table, they don't have egos. They're not so organizationally focused that they're being self-centered. I think the people who are coming to the table, who've been at this work for a long time, are saying, listen, we got to do something right now, and we must do it for the better good of the community. And I'm willing to put down any self-centered ideas for the good of the whole. And I think that has been a very key piece to us developing what I consider to be the next iteration of Chester's rebounding, is coming together to be a better community.
I definitely would just echo Dr. Williams' sentiments. I think that one way that we continue to kind of build on this momentum is look for those opportunities where we may not traditionally see them. I think, like you mentioned, there are hospital environments and even community-based environments where traditionally interruption wasn't seen, and is now starting to see some of the benefit and the contribution that the interrupters can make, and how important that is to a community like this. And so I think that that would be part of the encouragement. And I think definitely, again, where we look to engage more as the coalition is looking for more of those opportunities under this umbrella of targeting gun violence in the city. What are the different ways that community leaders and organizations are doing that? And how can we come together and provide a supportive environment to do that? I think that's going to be super important, because the work is hard, but when we join together, the lift becomes easier.
Well, this is Sandy, just speaking again from the Crozer Health perspective. We thought long and hard about how we can work on the problem of gun violence in the community, and rapidly realized that we needed community help, because you can't come in as outsiders to a community and do this work, but also the importance of wraparound services, that it's not just talking to people in the hospital, it's talking to people in the community and taking care of them once they're discharged home, and taking care of their families, to kind of break that cycle of violence that really has gone on for generations in some instances some instances. So it's from our perspective here at the hospital, it's really critical that we have really partnered with 2 community organizations who can get into the community and with our assistance with identifying patients, really help to get a grip on these issues that have been going on for far too long.